It feels so purposeful and meaningful.
It makes me feel hopeful for this community.
It reminds you why I became a doctor.
The excitement is kind of contagious.
I mean, this is something that everybody can do in their emergency department.
It's really hard for clients to access care, and this is streamlined access to care.
It's groundbreaking. It's new. Not a whole lot of programs like this throughout the country, and I would say not a whole lot that run this well.
We've seen that smooth process from the ED to our program has really helped with the engagement.
That excitement builds and decreases the stigma that goes along with this.
It's been a blessing on multiple levels because it's helping to reduce the stigma of MAT.
Just like we treat illnesses, we treat it with medication, we treat it with extra care, we treat it with extra support, and these clients need that.
They're worthy of having a good life, just like anybody else.
The timing could be better. This is as bad as I've seen it in my whole career.
I'm proud of our teams, I'm proud of the network that we're building. The relationships are important. That's what makes it exciting and valuable work.
The work we're doing is greater than just our program and just us.
The Bridge is UT Medical Center's answer to try to get care for opiate use patients quickly and efficiently. It's the bridge to recovery. So we're going to take you from the ED and deliver you to the place where you can get help continually. So we've bridged the continuum with this program.
We see people come in as an overdose, and a lot of times it's not intentional.
They're often ending up in the ER with overdoses that they had never experienced before in their lives. And so this is our opportunity to change their life and get them away from these opioids.
We want to reach people where they are. And so finding the people at the emergency room as soon as they come in with whatever their issue is, an overdose or a suicide attempt or just coming and asking for help, we want to be able to meet that need at that time.
We talk with them and assess their stage of change and determine together whether they're willing to or wanting to do something different. And if they are, we introduce the program.
When they've come to the ED after a crisis, after overdose, they're ready for change. They're like, I don't want to do this again. I don't want this to happen again. I need the services to get me back on my feet. And it's a prime opportunity in that process for them to get them into our program so we can support that.
They can have immediate care, and that is so helpful to people.
We're initiating, MAT from an emergency department setting and having that direct transport to the outpatient appointment. That's nothing like we've ever done before.
If you come with high blood pressure, you leave with a medicine for high blood pressure. What's different? To me, there isn't any. I'm a scientist. I don't care about the moral piece. These are good people.
We've had amazing success so far. Our engagement rate right now is at, I think, 71%. And we have our first client, he's been in the program for about 60 to 90 days.
It was hard to start a program during COVID, but it was the thing that people at the bedside needed.
Especially through such a difficult time in the healthcare field, it's nice to have this boost of encouragement that we're really changing lives.
I'm excited that we're actually able to help people instead of just saying, here's a brochure, I'm sorry, I can't do more. Now I can actually help them towards their road to recovery.
Before the Bridge program, we had to just offer people a way to get help. Now we're able to directly place people in a medication-assisted treatment program.
When the medical staff are seeing the success stories and they're seeing the benefits of recovery and that it's possible, they're buying into it too, and they get excited too.
That is a wave of energy you can ride for a very long time.
I am excited to see the growth of our clients. I think most of all, it's possible because we have a great team of people who are focused on client care and driven and put the clients first.
I'm excited about where this program could go. I think it's been even more successful than we anticipated that it could be.
I'm excited about the future of peer support in the ED and wherever else we may be, because I think we're really making a difference in the community.
Our future will be to expand this program. Everybody can do this. You just have to be willing to start.